Ear infections. Now, a lot of kids suffer from ear infection after ear infection, and is it more prone in? Why are some kids so prone to it, and are boys more prone to it than girls?
Boys are not more prone than girls, as far as I know. There may be slight differences in studies they've done, but in practice, I haven't seen any difference there.
Okay.
The reason why kids are more prone to them has to do with the anatomy of their ears.
Okay.
And the fact that they get more colds and get more illnesses than adults do.
Mm-hmm.
So the way ear infections happen is you have a tube that goes from your middle ear to your throat called a eustachian tube, and it's responsible for draining fluids and equalizing pressure there in the middle ear cavity. And if you have a problem with that, then it doesn't drain the fluids as well. The fluid accumulates in the middle ear, and that can get infected by bacteria.
Okay.
So in kids, because their tube's a little bit shorter, they tend to have more problems with that. And as they get older, they tend to get better. That's why we see ear infections more common in little kids, usually less than age 2.
Right.
And as they get older, it improves with time.
Okay.
And then the other reason is when you have a cold, like we talked about, one of the complications of having a cold was ear infections. And a lot of those kids, at least a third of them, can develop ear infections with colds. And when you have cold and you have a lot of mucus secretion, things like that, that can cause problems with that eustachian tube, draining the fluid, and that causes it more likely for them to accumulate the fluid and get an ear infection there.
So can you get an ear infection without having a cold?
You can, yes.
Okay.
But we see it more commonly in kids that have colds. They'll have a cold for a few days and then develop an ear infection later. But there are some kids who do get ear infections without colds. It can be both ways.
Now, how different is otitis media, right?
Otitis media is the name for a middle ear infection, yes.
Okay.
What we commonly think of in kids as an ear infection.
Ear infection. How different is this kind of infection from what you get when you're swimming?
It's a different kind of ear infection, usually different pathogens also, different bacteria that causes it. So like we talked about, otitis media is a middle ear infection, which is behind the eardrum. So you get an infection behind the eardrum from fluid, and that accumulates back there. Otitis externa is the name for swimmer's ear, or the external ear infection, and that's an ear infection of the outer ear canal.
Oh.
Yeah, and we call it swimmer's ear because kids who are swimming, we're seeing a lot of this, by the way, in the clinic in the summertime, because kids are swimming a lot, and it has to do with them retaining moisture in the ear canal, and it just stays there, and it makes them more prone to having a bacterial illness there.
Okay. So what should you do when let's say the child comes out from swimming or takes a bath? Should you actually be cleaning their ear or not?
Yeah, you should try to dry their ear so it doesn't stay there.
With what?
You can dry it with a towel, and there's also drops you can get, like swim ear drop. They're usually some sort of solution of alcohol, like rubbing alcohol or vinegar solutions, and they help to dry that fluid that stays there in the ear to make it less likely for them to develop swimmer's ear.
What about Q-tips?
Q-tips, in general, we don't recommend digging in the ear with Q-tips, just because there's a risk of causing scratches or problems with the eardrum if you go too far. So if you're just using it on the outside to clean, that's okay if you're just on the surface. But typically we don't recommend, especially in kids, sticking it really far in there and trying to clean. The most effective way would be to use those drops like we talked about. And if someone's prone to ear infections, I'll often tell my patients for them to wear earplugs, so they're not getting ear or water that goes in their ear when they're swimming.
Okay. Now, even when you have the middle ear infection, sometimes you get effusion with it, right? Sometimes you can get a perforated eardrum with it, which sounds horribly scary. So can you tell us a little bit about that?
Effusion just means, we talked about how sometimes that fluid accumulates behind the eardrum, and that's just what effusion means. It just means the fluid back there. But one of the complications of ear infections is a perforation of the eardrum, which does happen from time to time. And it's just because when you have an ear infection and you have pus inflammation, you can get bulging of the eardrum, and it can sometimes rupture.
Okay.
And usually it doesn't cause problems.
So you don't end up with hearing damage?
Not usually, no. Usually the eardrum heals fine, and it heals without any issues. You treat it with antibiotics, and I'll usually, those kids that I have that, I'll put them on antibiotics, and I'll have them come back and see me once they're done to make sure that their eardrum is healing fine. But typically they don't have long-term complications usually from that. And actually, a lot of the time it gives them relief. If they're having a lot of ear pain and, they're up all night having lots of pain, that rupture of the eardrum actually relieves the pain.
So it gives
relieves the pressure.
Parents a lot of relief also. All right.